thank you for inviting Pam and myself to discuss medical trauma and looking at it through a family lens. To start off with, we'd also like to make an acknowledgement of country. So we'd like to begin by acknowledging the traditional custodians of the various lands on which we're joining from today. I'm speaking to you from the Hills District of Sydney, which is the traditional lands of the Darug people.
And I'm joining you tonight from Canberra, the lands of the Ngunnawal people.
And we pay respect to elders past, present, and emerging. Just a little bit about Belongside Families, Pam.
Sure. So Belongside Families is a not-for-profit organisation that empowers families of children with developmental delay or disability. We focus on building skills, knowledge, and confidence. What makes our approach unique is that everything we do is shaped by families' real experience and need. So our programs include workshops, peer groups, webinars, and resources, all designed to meet where our families are at in their journey.
So, a bit of a brief introduction. I'm Kelly and I'm a mum of four. Previously, I was a teacher and I have experience in counselling. My four children are aged 20, 17, 11, and 8. They certainly keep me busy. And two of them have one has a rare congenital condition, and the other one has a rare autoimmune condition. Anne?
So I have four children. They are 11 and a half, 8, 7, and 4 tomorrow, which I didn't authorize. So I have my four guys there. My eldest son, Christopher, has a whole bunch of severe disability and medically complex diagnoses. He's an anomaly and continuously has our very vast and extensive team of professionals and expertise baffled. He likes to challenge them all and keep them on their toes. So that's the kind of experience that I bring tonight, is just keeping those four kiddos alive, which is a challenge in and of itself.
So tonight we're talking about understanding medical trauma. Now, it usually refers to a patient's psychological and physiological response to a negative or traumatic experience in a medical setting. This experience may involve illness, injury, pain, invasive or frightening procedures, or distressing or dismissive medical treatment. Gabor Mate defines trauma as not the traumatic event itself, but the internal psychological wound or concussion that results from the event. So it's not what happens to you, it's what happens inside of you as a result of what's happening to you. We have big T trauma and little t trauma. So, big T trauma in a medical setting would be those acute medical events, so severe injuries, life-threatening illnesses, or a sudden diagnosis. It may be a hospitalisation, which could be an intensive care stay, a prolonged hospitalisation, medical procedures, so it may be a traumatic childbirth or a difficult medical procedure. And it may also be witnessing trauma, which many of our parents have experience of. So, witnessing their child have painful procedures or needing to be resuscitated, any of those things can cause trauma. Some examples of little t trauma. So, that provider patient relationship. So, feeling like your provider is dismissing you or doesn't believe in your pain. A series of negative or unprofessional encounters with different clinicians, a loss of control, so being restrained during a medical procedure or receiving disorientating medication, or even that lack of autonomy during examinations or treatments. It can be a gradual build-up. So, chronic illness that requires frequent or stressful visits to doctors. It might be a series of minor injuries or illnesses that lead to cumulative feelings of being overwhelmed. Other stressful experiences might be a sudden or difficult move to a new hospital or clinic, experiencing physical pain or shock without significant explanation or comfort, or being treated by a provider with a history of malpractice or a broken system. So, as I explained before, I have two children who've had experience of medical trauma. The first is Lockie. He was born with a congenital condition, and um, there was a few missteps around, I suppose, being made aware of that before I gave birth to him, and of course, no real clear guidance when he was born as to what we were sort of expecting or looking at in our future. His first surgery was at 5 weeks, and he had another one at 9 months. He had biweekly casting, which was quite distressing for him. He would scream the physiotherapy department down, and I would often have to hold him to try and get him to calm down in those situations. And we were constantly going to ongoing appointments, so imaging, physio. He had a nerve conduction test when he was 18 months old. The impact on our family, my two older girls at the time were 9 and 6. Um, and it was this constant juggle between medical and family needs. There was a lot of guilt that came for me being able to try and cater for all of their needs. At the age of 4, he had surgery and his cannula tissued, and it meant that he was not having any other cannula put in, but because he had an epidural, he had to. So we were moved to a treatment room. When they first tried to get it in, they then decided to fast him for gas. Um, that meant we stayed overnight in that treatment room. And the next morning, when the gas still didn't work, the doctor told me that I was distressing the staff. Um, no concern as to the distress that it had caused myself or Lockie. This left a lasting emotional mark for him when he went back to have surgery again. He did not want to have that mask put on, which then put in jeopardy the chances of us having surgery for that particular time to take out the 8 plates that had been put in. Um, and since then, whenever he has to go into that treatment room, he will refuse, hates that room, cannot go near it at all. His wheelchair is allowed to stay in there at night, but he will not go in it. Um, as for Belle, who is my eldest child, a simple finger jam in a car door at 15 sent us to hospital for frequent washouts, long hospital stays. The longest was 7 weeks, and that was over Christmas. And it was a huge separation from family because it was right in the middle of COVID. Um, there was many complications along the way, PIC lines being infected, because they thought of the infection that they thought she had in her finger. Quite heavy antibiotics were given, and that led us to an epilepsy diagnosis. When she had her first tonic-clonic seizure, she was at school, so it happened in front of her peers and teachers. Um, there was significant school disruption between years 11 and 12. The epilepsy would cause cyclic vomiting, and she would often be exhausted and not able to make it to school. Because it was during COVID, uh, she was often had to attend medical appointments on her own. Her doctor would not let me in the room. And I was told that because she was 15, she was actually able to consent to surgeries herself. Um, and I even had two kids tag team in the 1 week. I had Lockie have a surgery on a Monday and she would have a surgery on a Thursday. This condition that she ended up having, despite the fact that I'd asked multiple times, was there a condition where skin just didn't heal? I was told that that was not a thing. And in the end, the orthopedic made the decision that he would write in a letter back to her infectious diseases doctor for her discharge that she was probably doing something to it herself. Luckily, that infectious diseases doctor chose to get us a second opinion. That doctor put it in a cast for 6 weeks, and when it still didn't heal, we were finally referred to a dermatologist after 10 months. We ended up seeing 3 dermatologists then over the next probably year, multiple misdiagnoses. And even once we did receive a diagnosis, we then had to be transferred to another medical facility to actually receive treatment and start the diagnostic process again. Because it's such a rare condition, it's not something that doctors like to diagnose lightly. So for us to finally get that diagnosis, it was probably another 6 months down the track before we were given a firm diagnosis. And I will hand over to Pam.
Sorry, it's feeding time at the zoo at my house, so it was a little noisy. Okay, so my boy Christopher is 11 and a half now. And he has had way too many hospitalizations to count in his short life. When he was younger, we were averaging 8 to 12 admissions a year. Majority of them respiratory related. All of them were 4 to 7 days in length and nearly always involved IV antibiotics and oxygen, the administration of chest physio and suctioning treatments, because he was constantly aspirating, which led to aspiration pneumonia. Excuse me. I'm not joining him, I promise. Oh, excuse me. Okay, so each time this happened, goodness me, it would involve us needing to go to the emergency department to access the help that we needed, and where we would sit and wait for them to have a bed on the ward. He would have to have bloods drawn and cannulas inserted. There was always a ridiculous amount of waiting around, a ridiculous amount of over-explaining ourselves and our concerns to the myriad of doctors that needed to come and confirm that this was what was happening. And there was always lots and lots of protective cuddles, particularly when he was so little. They had lots of trouble with drawing bloods and getting cannulas in and things. So my fierce mama bear learned real early to draw the line. After 2 tries, anything after that, they weren't allowed to come back near him. So there was all of that happening, and that went on for years and years and years. He, like I said, he's a bit of an anomaly. They don't actually, they're always a bit bamboozled by him. So we had doctors talking to us about a surgery for a peg when we were in NICU. But he went about his business and was able to swallow on his own. And we were able to feed him. He didn't eat like a normal 3-year-old. He was still on bottles and thickened solids, but he was able to eat. But he was expelling more energy than he was consuming. So NG tube was recommended to supplement his diet. Within a week of that going in, he was refusing everything orally because the aggravation of the tube on his throat, he just despised it. He's been nil by mouth for 8 years now. We suffered through the NG tube for 12 months before his peg went in. But my boy is determined and will not be told no. And he pulled that tube out at least 3 times a week. So here in Canberra, they don't train families how to reinsert it themselves. So we had to take him to the hospital at least 3 times a week to have it put back in. So we had a whole bunch of different people on speed dial, and I never thought I would have on speed dial. On top of all of this, he's also undergone a number of invasive and quite major surgeries, including when he was 4, he had a bilateral femoral osteotomy done because his hips were migrating and they needed to be relocated. There was lots of things that were glossed over when we were counselled about surgeries, and I'm sure Kelly's experience is exactly the same. There's so many things that just get completely glossed over, and we were under the impression that once the cast came off, everything would go back to normal, and that was not our experience. His recovery from that osteotomy was one of the steepest learning curves I've ever been on, and the hardest, darkest time of my life. And it was 12 months before he fully straightened out again after that surgery, because the muscles had shortened while the cast was on, and he's clever enough to understand and associate movement with pain, but he doesn't have the capacity to be able to understand if he pushes through that and moves, it will feel better. So he just associated movement with pain and refused to move. So some of the emotional impacts of all of this, talking about triggers, Christopher is nonverbal. So all of the experiences that he's undergone in his life have taught him how to react and interact with the world around him, and all of the experiences influence the way he reacts. The messages that he's communicating to us are not always clear, but Tom and I are really in tune with him, and we have awareness of his history, and we've intentionally built a team around us that also has awareness of this. As his parents, we have intimate knowledge of him as a person. So we are usually, because he does occasionally throw us a curveball, able to work out what's going on for him. So like I just mentioned, he associated very quickly movement with pain, so just refused to move. That went on for a really long time. For a really long time too, he still occasionally does this, but not to the same extent. If we wheel him into a small white room, he will cry and throw a fit. He will fight us on absolutely everything, because during the time that we had the NG tube, the treatment room at the hospital where it was reinserted was a small white room with a curtain and a bed. It smelt funny, and he could pick up on everyone's heightened emotions when we were going in there. So if we go into a small enclosed room that has a curtain and a bed and some heightened emotions, he's fully expecting you to lie down on that bed and try and shove something up his nose and down his throat. Years later, he's not had anything near his nose since, other than oxygen. But that's his expectation. We could have just been going to the GPs to get some scripts refilled, and he would throw an absolute fit because he was expecting someone to try and do something horrible to him. On the topic of being nonverbal, he has learnt to rely on us to be his voice. It's our communication and advocacy on his behalf that gets us through the admissions, treatments, surgeries, and procedures with as little drama and stress as possible. But there is only so far that our advocacy can go. It also relies on the people that we're interacting and communicating with to actively listen to us, to respect the relationship that we have with our son, and to work with us in tandem to ensure that that goal is achieved. So I have a quick story that I want to share with you guys. Christopher's last hip surgery was actually the best recovery we've experienced. Sorry, for context, he's had 4 hip surgeries. His last one was the best recovery that we've experienced. We had actually weaned him off the pain meds within 2 weeks, which has not happened for him previously. We were super happy with where he was at within his recovery. 4 days after we'd got him off pain meds, he started crying. It was really consistent, really persistent, and it didn't seem to matter what I did. I couldn't break through. It didn't matter if I gave him pain meds, if I repositioned him, I couldn't get through to him. So I took him up to emergency to try and work out what was going on. We spent 4 hours sitting in emergency to be told he's just recovering from hip surgery, double the pain meds, he'll be fine. I listened to my gut that day, and I rang my physio and said, he's not okay. I'm not happy with this course of action. We contacted our surgical team in Sydney, and they said, we've got room in our clinic tomorrow. We can see him if you can get him here. Took him to Sydney. As soon as we got there, they took the cast off. If I had listened to the advice of the professionals that I saw in the ED and just doubled his pain meds, he would not be alive. We were about 3 or 4 days off his pressure sore reaching the kneecap and the infection hitting his blood, and he would not have survived that. So it's kind of, that story is like a really great example of just how dangerous it can be when we don't listen to families. But I'm also so incredibly grateful that there were people that, when I pushed back, listened to me and took on board what I was saying. So over the years, we've had a myriad of experiences with a plethora of medical professional services and settings. One thing that truly does make us feel safe and gives us the confidence that our boy will be okay is when we're included, valued, and respected. Our pediatrician is always followed by a gaggle of student doctors. When we're in hospital, they all file in every morning to examine Christopher. They talk amongst themselves. They talk about with our ped what they think, treatment, course of action, etc., etc. And he, without fail, before he agrees, disagrees, or acknowledges their answers, always turns to me and says, "What do you think, Mum?" And there has been multiple occasions where I've said he's not ready to go home, and that afternoon he's crashed again because those students were ready to send him home because his numbers were good. He tells the students over and over again that parents are the experts. We always have to include them and ask them for their opinion. These simple gestures reiterate to me that the time, effort, care, and love for my boy is not in vain. That my opinion, my gut, and my knowledge is important and valued. It's given me the confidence to speak up when I don't agree with what's going on, and it's taught me how to best advocate for our boy. So I want to speak to you now a little bit about the parent experience of medical trauma, because it's a little bit different in terms of it's not always necessarily considered or thought about. So in terms of advocacy, the advocacy that we do is exhausting. It's endless, it's relentless, and it's emotionally draining, especially when words of concern, care, and love fall on deaf ears and are constantly dismissed, pushed to the side. You start to second guess yourself and you question everything. But for a lot of families, when the path to treatment or diagnosis is not clear, this like fierce advocacy is our only option to be heard. And that's something that can be really daunting because it is a hard slog sometimes for so many families. As I mentioned, it's not always acknowledged, the impact of the medical trauma on the parents and carers, especially at the end of a admission or in a medical event. There is this general expectation by society that we can just put on our big girl panties and get on with life. Like, okay, that's over, moving on now. It didn't happen to you, it happened to your kid. But we've watched that traumatic thing happen to our child. I consider all of my children a piece of my heart walking around outside my body. So when things happen to him by default, they happen to me too. It takes time and intentional effort to process and accept and reconcile what's gone on with your child. And given that our kids often need so much extra things and so much more emotional time and effort and energy, we're not always given the space and the grace to be able to process. We have to kind of just put a lid on it and come back to it later. But that opportunity to come back to it later, they're not always as long or as helpful as they need to be. It's like a quick shower cry and then moving on with life, and that's not always enough. And then in our times of need, we do need to turn to the very people who dismiss, second guess, and question us. We have no choice but to hand our precious child over to them, step back and hope against hope that they can do something to help. And that balancing that trust and that fear is something that so many people have to do. We're not always very good at it. We can often get in our own way when we do need to do that, but it's purely out of love for our kids. And especially if our experience with the people that we're handing them to, the professionals or the medical people that we're handing them to help them, haven't always listened or helped in a way that's beneficial in the past, that can be really, really difficult for families. So I think just there's, being mindful that there's that going on in the background too can mean a lot to families. Now, it's not just our children's needs that we need to meet on a daily basis or in the midst of a medical emergency. It's also the needs of our other children, our spouses, our support networks, and ourselves. So we're constantly assessing, reassessing, making decisions of family need versus medical need. And it takes a toll on our mental health, our family life, our confidence, and our capacity to care for the people and the things that I have just listed. And at some point, something has to give. Without the correct supports in place, families just cannot sustain that level of hypervigilance. I am incredibly lucky to have met some incredible services professionals and individuals along our journey with Christopher. They're people who've always checked in, not just with him, but with myself and with my family. They acknowledge the work, care, and advocacy that we do for Christopher day in, day out, and they value our input. My GP, when I had Christopher, he wasn't even a year old. She said to me, because I'd put off taking him to the doctor for 2 days until we got paid, and she said to me, "I will always bulk bill you. Don't you ever not bring him because you can't afford it." So, and she's been true to her word. She has bulk billed me for every time I've needed to see her for him. And just the comfort that I have someone in my corner that understands the worry and the concern and what we're going through, and knowing that I can access her whenever I need to, not just when my bank account says I can, was a massive relief. I've already spoken about my incredible pediatrician who really does put us in the forefront of all of the decisions that he makes. We've got an incredible rehab team who don't just acknowledge how well we know our child, but they also acknowledge and recognize how interconnected everything is. Like, we can't just treat his scoliosis separate to his respiratory issues because they go hand in hand. And we also have been linked in with plans and palliative care teams who recognize and assist with all the extra admin. They are happy to act as mediators between services, so I don't have to remember the right jargon, and it adds weight when there's someone else that's doing all that navigating. It's these small, thoughtful acts of genuine care that have the biggest impact. These are the people that I'm going to remember at the end of our journey with Christopher as people who've truly made an incredible difference in how we can care for him, because I can just concentrate on the love and the fun stuff and the cuddles, and they do all the other stuff in the background. And I think it's not lost on me how fortunate I am, because I know that there are lots of families out there that don't have that experience.
So I'll keep this quick because we don't have a lot of time left, but what families need from GPs or health professionals. So when working with family who've lived through repeated or distressing medical experiences, your approach matters more than your intervention. So start by creating physical and emotional safety, slow the pace, use calm tones, make eye contact, create a foundation for building trust and facilitating healing. Validate their feelings. So that sounds really hard, can diffuse the defensiveness and open up trust. Recognize that parents often carry deep expertise of their child's condition. Collaboration builds empowerment. Be mindful of potential triggers and, when possible, offer control or a choice. Familiarise yourself with trauma-informed care and build a trauma-informed workforce, training your front-end staff to doctors, recognising how to respond to trauma. Emphasise the patient's resilience. Focus on their strengths and their coping strategies. Collaborate with them and the parents in the treatment and care to empower both the patient and parent. And finally, end every interaction with compassion and hope. Remind families of their strength and reinforce that they are not alone. And just a final quote. So, every small act of empathy, a kind word, a moment to listen can change a family's experience of the system. Thank you.